Also, if you're going to sneeze, like that lady just did in the last picture, think about sneezing into your sleeve. Okay? It's one of these habits that for years we've always sneezed into our hands or into a tissue. We just don't always think about sneezing into our sleeve. That's something we need to get good at because we're really not good at that. I think kids do a much better job with this than what most adults do. Okay, what is in a seasonal flu vaccine? Well, there are two strains of influenza A, and usually an H1 and an H3. But like I said, there are different versions of this, but usually have an H1 and an H3, and one strain of influenza B. The injectable flu vaccine is killed, so it cannot give you the flu. So if someone says you're going to get the flu by getting the vaccine, not true. Okay? If you do the nasal spray and get the flu mist instead, that might give you a bit of a cold, a head cold. You might get a runny nose with a bit of a sore throat, but you're not going to get the flu from it. Okay? But if you want to go ahead and do the injectable form, all you're really going to get is a sore spot where you had the injection done, and that goes away in a few days anyway. It's much better off having this little sore arm than what you're going to have the flu, because the flu's going to last for several weeks. What flu shots are needed this year? Okay, first of all, a seasonal flu shot's recommended, and also the H1N1 is recommended. So you really should consider getting 2 flu shots this year. The seasonal flu will most likely arrive as fall approaches. Not quite sure what's too long, but then the seasonal flu shots will probably not protect against the novel H1N1. So right now what we're seeing, unfortunately, is a lot of the H1N1 in the hospital, and many people have not had this vaccination yet. So hopefully we'll get it out. We'll see it out more in the public and more in the news. Currently, I believe they have ordered like 1 million doses for the state of Texas. Well, that won't even cover Dallas County. So there's really not a lot out there. More is coming out. The CDC is getting it out as quickly as they can, but it's very time-consuming to get that out to the different areas. But the seasonal flu, we anticipate that next spring, the seasonal flu is really going to take over. So the H1N1s could be dwindling off while the seasonal flu is picking up in the usual spring-like format that it usually does. Okay, so who should be vaccinated? Children ages 6 months to 19 years. Pregnant women, and the reason we need to do pregnant women is because we cannot vaccinate a newborn. Okay? So for the first 6 months of their life, they'll still have the immunity from mom if mom had the vaccination done. People ages 50 years of age and up. I believe on the news they've been saying like 55 or 65, but I did check this morning on the CDC's website, and they are saying age 50 and up. People of any age with certain chronic medical conditions, people who live in nursing homes, and people who live with or care for those at high risk for complications from the flu. So we're talking primarily the very young and the very old and pregnant individuals. Now, along with the people who live in nursing homes, we also have to consider people that live in tight quarters, like individuals that are in jail, incarcerated. There was a lot of information on the news this morning about them, that they're being vaccinated right now for the flu. And other people are saying, well, why don't I get a shot when someone that's incarcerated does get a shot? So that's another can of worms that's been opened up. So if you get sick, be nice to others, okay? Don't expose others. Stay home. Let me tell you, we have a nurse that I work with, and her daughter-in-law was diagnosed last week with the H1N1, and the day she was diagnosed, she wasn't feeling too bad, so she went to the movies. Don't go to the movies, okay? Stay home. I know someone else who was just diagnosed that, of course, the first thing you have to do, you've got to get your Tamiflu prescription, and you're going to go to the pharmacy and get it filled. Think about all the people you're exposing in the pharmacy. If you can get someone else to fill your prescriptions for you, please do so. Don't just take your little prescription and march your little self into the pharmacy to have it filled and expose every elderly person there that's getting their cardiac medications. Also, if you need to go to the emergency room, the people that need to go, not just if you just feel kind of achy, don't rush off to the emergency room. It's a very busy place, and you might be sitting for a long period of time. But if you have to go to the ER, the things you're going to go for: any difficulty breathing or shortness of breath, any pain or pressure in the chest or abdomen, if you have any signs of dizziness, confusion, or severe or persistent vomiting. You may have some issues with dehydration. You might need to go to the emergency room. Other than that, you try to use your doctor's offices and just go get some, your Tamiflu if you need to. My daughter, I had dinner with her on Monday night. Now, my daughter's 21 years old. She lives on her own here in Denton. And all through dinner, she kept complaining about the back pain she was having. She was feeling fine other than the back pain. Well, then yesterday afternoon, she called and she says, I don't feel very good. She said, I've got a fever, and my back really hurts, and I got a bit of a cough. And the first thing I thought was, oh dear, I need to take her to the doctors. So my daughter is also uninsured. So I got to take her to the doctors yesterday evening. And the first thing they do, after the doctor comes in and does his assessment and chats with her a moment, he was trying to decide if it was allergies or swine flu. So he did a nasal swab on her. The nasal swab takes 11 minutes to come back. Hers was back in less than 5 minutes, came back positive. So my daughter has an H1N1. And of course we had to pay almost $100 for the doctor's visit because she's uninsured. Then I took the prescription next door to the pharmacy and had that filled for Tamiflu just for her. And she takes it twice a day for the next 5 days. So 10 pills, $102. Very expensive, okay? Now the thing is, yes, she's sick. She looks like she has a really bad head cold today. But she probably would have been fine without the Tamiflu, but without it, it takes about 3 weeks to get over this infection. Okay. So she really did need it so she can get back to work, so she can pay her bills, and even though she doesn't have health insurance, well, I can cover the bills, but that's another story. But anyway, there are a lot of people out there that don't have health insurance, and it's just very expensive for them, and it's just a sad state of affairs for that. Now, other smart ways to prevent the flu. Avoid close contact. So, like I said, stay away from movie theaters if you're sick. Don't go to the grocery store. Don't go to Walmart. Just try to keep sick people at home. Like I said, stay home if you're sick. Cover your mouth and nose when coughing and sneezing. Wash your hands often and keep your hands away from your face. We're just so busy all day long touching things and moving things. Just keep your hands off of your face. So, what questions do you have?